So I'm going to go ahead and kick it off. My name is Holly Whaley. I'm the communication specialist for Gallatin City-County Health Department. Today we have on the call Lori Christenson, our Gallatin City-County Health Officer. We also have Tracy Ellig, who is the Vice President of University Communications at MSU, who's going to provide an update. Louis Mendiola from Bozeman Health. He's the COVID-19 Deputy Incident Command Lead. He will also be providing an update. On the call, we also have Dr. Andrew Sullivan, who is a pulmonologist and critical care physician at Bozeman Health, and Dr. Kathryn Bertany, a pediatrician hospitalist at Bozeman Health.
Thanks, Holly. I will just go ahead and start with a really brief update with our epidemiology for Gallatin County. So I'll share my screen. Okay. So we're going to start off with our daily and 7-day average COVID-19 cases per 100,000. We are seeing a small increase from our 20.5 cases per 100,000 as of last week when we reported to 25.4 cases per 100,000. And so you can see that reflected here in our epi curve towards the end of this line here. In terms of daily and 7-day average percent positivity, we also have seen an increase in our percent positivity. We were at 7% positivity at the end of last reporting week, and then currently we're at 8.5% positivity. And so just as a reminder, this red line right here that you see, this is the 10% positivity. So we are below that, which is good. What we get concerned about is if we move past this red line, we are worried that we may be missing a significant number of cases. So below 10% with the percent positivity we have now, and seeing the number of testing that is being conducted across the county, we're not concerned that we're missing a significant number of cases at this time. Again, good news in terms of the turnaround time from our from reporting of a specimen collection to report to public health. This is important so that we can be, quickly identifying close contacts and working through that disease investigation. So timely reporting from a specimen collections to public health has been 1 day. Median time is 1 day. And then we'll go to our percent of Gallatin County residents who've received their first dose of vaccine. I'm happy to report that we have seen across all of these age groups at least a 1% increase in all of the age groups for a first dose this last reporting period. Similarly, we've seen an increase in our fully vaccinated, especially in this 12 to 17-year-old age group. So this is also, we're trending in the right direction in terms of the interest and the uptake in vaccines. And then lastly, we have data here that describes the number of active cases in our K through 12 schools and at Montana State University. And then finally, we'll just point out, we continue to be in high transmission. Again, when we're in high community transmission, the recommendation is to wear a mask indoors, whether or not you're vaccinated or not fully vaccinated at this time. So with that, I'm going to go ahead and turn it over to Louis for an update from Bozeman Health. I'll stop sharing my screen.
Louis, I think you're muted.
Thank you, Holly. Again, my name is Louis Mendiola. I am Bozeman Health's Deputy Incident Commander currently, and I definitely appreciate all of us coming together for this important press briefing. To kind of give you an operational idea of what is going on within Bozeman Health, we currently have 15 patients confirmed positive for COVID-19. This includes 4 critical care patients. Over the course of the last 2 weeks, we do track the percent of positive patients. Upwards of 80% of our COVID positive patients that are admitted to our inpatient hospitals have been not vaccinated. We do have a few patients that are vaccinated and are in our care. However, generally speaking, these patients are not in the critical care unit, and their prognosis is far better than those who are not vaccinated. Our infection prevention measures remain in place as they have been since the beginning of the pandemic, which started in, as we all know, early part of 2020. We have updated our visitor policy to currently only allow for one visitor. Masks and or face coverings are required for entry into any Bozeman healthcare site and must be worn throughout the duration of the visit. It is important to note that we are seeing very high levels of folks seeking COVID-19 testing, specifically at our ambulatory care sites, our urgent cares, primary care clinics. Additionally, we reopened a Lot H testing facility. All testing information is easily found on our website. Please review our website for information on locations, times, and other details. As we mentioned before, we are seeing very high levels of COVID-19 hospitalizations. And for the most part, these patients are not vaccinated. Our incident command team highly encourages vaccinations for those who have not yet received the COVID-19 vaccine. Please review all available information from the county health department. There's also information on our website about where you can find vaccines. There is no shortage of vaccine. We want to make this as easy as possible for the community. If you're thinking about getting a vaccine, this is your call to action. This is the time to get the vaccine. It makes a difference, and we are seeing that not only in the transmission of this virus, but also it makes a difference in our ability to care for these patients and to continue to care for the community. If patients are vaccinated, it takes a whole lot less than if they are not, and they become more ill. I also want to call attention to Montana State University, the Bozeman School District, and all area schools who have made recent decisions to require masks for school facility entrance for both staff, students, and visitors. This is a very, very important and crucial decision, and Bozeman Health thanks those leaders for making this decision. The last year has made it very clear that keeping kids in school is critical for their mental health and their academic success. We must, however, continue to limit the spread of COVID-19, especially in our schools, and doing so will help limit disruptions and the requirement of quarantining and the spread of this illness. Masks are one of the most effective strategies we have seen, especially for those who are not yet able to receive the COVID-19 vaccine. I am joined by subject matter experts and clinical leaders today. We'll open ourselves for questions at the appropriate time, and definitely want to thank the opportunity to participate in this very important press briefing.
Tracy, do you want to go ahead?
Hi, my name is Tracy Ellig. I'm the Vice President. I'm the Vice President of Communications for Montana State University. So last night, Montana State sent an email to all students, faculty, and staff that effective immediately, masks would be required at all indoor instructional classrooms, laboratories, studios, any indoor space where academic instruction is taking place. We did this after last week. We had sent out a call to action asking for voluntary mask wearing. And after 2 days of classes, it became apparent that that request for voluntary participation was not being heeded. So we have moved to a masking requirement that is in place right now. We will have this requirement in place. We will reevaluate it on October 1st and either extend or modify The other thing is we have made it clear that any student that feels that they do not want to continue at Montana State University because of this requirement, we have extended our full refund deadline to Tuesday, August 31st. So any student can get a full refund of their tuition fees and their parking pass till Tuesday. Our normal deadline was this past Tuesday, so we have extended it by a week. One of the important things here is that we have heard from a lot of students and a lot of parents, and including student leadership, that the most important thing to students is the ability to have in-person classes. And we want to be able to offer in-person classes to our students this fall. And so we're requiring them to wear masks while they're in those classes so that we can continue with in-person classes. I'll be here for any questions. Thank you.
Okay, with that, Louis, did you, with Dr. Sullivan and Dr. Bertany, how would you like to proceed?
I would yield to Lauren Brendel for her recommendations. Lauren.
Dr. Sullivan or Dr. Bertany, do you have a few remarks that you'd like to share? Otherwise, we can just open it up for questions.
Dr. Sullivan, why don't you go first and just give a summary of what you've been seeing over the past couple of weeks since the increase in the Delta variant in our community?
So I've been managing the ICU patients since Monday and finished up this morning, and my partner, Dr. Bethel, took over. As I discussed yesterday with the NBC Montana News, we have a 20-bed CCU, which consists of ICU beds and something called intermediate care beds, which are for less sick people. And we have 12 licensed ICU beds. That's how many we have for a community our size, which is an appropriate level for a community our size. As of yesterday morning, we had 7 of our 12 ICU status beds were sick with COVID pneumonia, 4 on life support, 3 not on life support yet, but with very close. That's why they're there. And this morning, out of our 12 licensed ICU beds, 2 of those people passed away last night or in the last 24 hours, and we've had an addition of a new patient. So half of our ICU beds are sick COVID patients with 3 on life support and the others teetering on it. So, and it remains a remarkable phenomena or fact that all of those are unvaccinated individuals, that we have not seen somebody who's vaccinated on life support for COVID disease. And so, this is, as far as illness and dying, not just positivity or mild illness, this is an epidemic of the unvaccinated. And so my, strong plea to people who have been putting off the vaccine because they don't think this is a serious condition, get a vaccine. It's, for most people, if you get COVID, it's a low chance of death. Make it lower. There's no reason to delay getting a vaccine. Please get your vaccine. And that's my strong message. Don't end up in our ICU.
Thanks, Dr. Sullivan. This is Dr. Bertany. I am a pediatric hospitalist. I've been with Bozeman Health for 2 years. Prior to that, I was a pediatric hospitalist in Boise, Idaho at St. Luke's. I still work also in locums at Children's Hospital in Los Angeles, where I see very acutely ill children with COVID-19. And I've been a pediatrician for about 20 years. What we're seeing now with the Delta variant of COVID is an increase of severe illness in those that are unvaccinated. The unvaccinated individuals are at the greatest risk, partially because vaccinated individuals can still transmit the Delta variant. If you're vaccinated, you're 88% unlikely or protected from symptoms. But even if you don't have symptoms, you could have it and be passing it along to others. And unvaccinated individuals are significantly more likely to get sick. For kids, this is so important because we only have approval for a vaccine for kids over the age of 12, but kids of any age can get COVID-19 and get sick. So for everyone to be vaccinated helps to protect those who aren't able to get the vaccine because they're either not old enough, they're infants through the age of 12. And I've seen kids as young as 29 days sick in the hospital with COVID. In addition, I just want to emphasize the importance of masking, because masking protects from transmission of the droplet of any respiratory illness. And what we saw very significantly increase in Bozeman Health Deaconess Hospital when everyone stopped masking was an increase of all respiratory illnesses, not just COVID-19. And kids at risk were getting sick and being hospitalized with croup, which comes from parainfluenza virus, with other viral illnesses like enterovirus and rhinovirus at a time of year in July and August when we typically don't see that at all. Those are usually wintertime viruses. So masking, especially for our kids in school who are hanging out with each other, as well as adults at home and in their learning environment, is incredibly protective for all of them. So my plea is just for continued masking indoors and in public spaces where you're around lots of other people, even if outdoors, and for everyone who is able to get the vaccine to be vaccinated. Thanks for the time. I really appreciate it.
Can I make one more comment that I forgot to mention, kind of coming off Dr. Bertany?
Yes.
That, what's distinctive about the surge we're having now of our critically ill patients with COVID is the average age of those patients, the 7 patients that were in our unit yesterday, was 59. They were 50-year-olds and 6-year-olds. They weren't traditionally the most susceptible patients to COVID. The 80-year-old people in assisted living and such, that highly vaccinated population has been amazingly protected from critical illness. And we are seeing younger people because of lack of vaccination. And that's, distinctly different than the pre-vaccination go around we had with COVID.
Great, thank you, Dr. Sullivan and Dr. Bertany. We'll go ahead and open it up for questions to the media at this point.
Hey, Lori, I have a quick question. This is Annie Johnson with KBZK. This is for my hospital officials. Was there ever a time this past week where all the ER beds were full?
I'm going to have to, did you mean for Lewis to answer that question? I might have to defer to Lewis.
That's just for anybody with the hospital.
I'm happy to take that. So in addition to being a pediatric hospitalist, I'm also the president of Bozeman Health Deaconess Hospital and Big Sky Medical Center. We've absolutely had days where all of our regular beds in the emergency department were full, and we were using hallway spaces, which were designed for times of overflow, but we have consistently been seeing higher volumes in our emergency department, many days as much as 20% plus higher than a normal day at the equivalent time of year in previous years.
So Dr. Bertany, thanks for answering my question, but do you think that this will become the normal, that it can be expected as far as the overflow?
It's really hard to predict at this point in time. And I don't have the data to tell you how many of those were respiratory illnesses versus other. We are seeing an increase in our stroke volume as well as our trauma volume. Along with the pandemic, we're definitely seeing an increased demand for mental health care and also our respiratory and other medical complications. So it's just everything across the board.
Gotcha. And I have one more question. I'm sorry. But I know in other places, it's like some medical procedures have had to be postponed because of just dealing with COVID. Has Bozeman Health had to do that? You know, non-emergency surgeries have had to be postponed or compromised?
Last year, early in the pandemic, we did have a slowdown in our elective surgical procedures. We are trying as best we can to maintain our responsiveness to the need for both elective and, of course, non-elective always goes, because elective is a relative term. If you're scheduled for surgery, it's never by choice. It's always something you need, and how long you can delay it is really up for question for the betterment of your health. So we have been able to, for the most part, maintain surgical services, but there were days this week when the number of our negative pressure rooms in the critical care unit were completely full. And we were trying to determine alternatives for placement of those patients who were either on life support or needing advanced oxygen therapy, which creates what's called aerosolizing procedures, and therefore they need to be in negative pressure rooms. And if we have enough patients that need that, we may need to use areas that would be for recovery from surgery to care for those critical care patients. And that could diminish our ability to move forward at our demand rate for elective surgery. So we are constantly in contingency planning and surge planning to determine how we can be available to the community and their healthcare needs during the pandemic, and trying our best to make sure that all of your healthcare needs are met despite the pandemic. Does that answer your question?
Yeah, I think so. So you guys haven't had to thus far?
We did about, it was the spring of 2020, right when the pandemic came out. We had a period of time that as we were ramping up all of our protective policies, had to slow down elective surgery. So there was a period of time that we did that last year. We are currently not limiting scheduling of surgery.
Perfect, thank you.
Other questions?
Yeah, Keith Schubert here with the Daily Montanan. I know there's some debate over prioritizing people getting their third booster shot and vaccinating those who are unvaccinated. How are you handling that internally, and is it playing a role in the allocation of your vaccines?
Can I answer
Okay.
that one?
Cool.
Or I don't know, we could give it to Incident Command too.
Yeah, Lewis can answer that.
Let's let Lewis answer that.
Yeah.
Thanks, Keith. Great question. We have, so first of all, just so that everyone understands, there is no shortage of vaccines in our communities right now. That is not, that's a matter of fact. We have vaccines. Anybody who needs vaccines, whether it's a first or second dose, can get it. Relative to the conversations that are going on about the third or the boosters, we have developed clinical protocols, policies, and guidelines about delivering those to our immunocompromised patients. Those fall in line with best practices and guidance from CDC and other jurisdictions. So we have already implemented that. We are finalizing plans to provide boosters to a more broader group of individuals. As we saw with the initial vaccinations, we will, prioritize the most vulnerable and then the most at risk. Obviously, a number of those would be healthcare workers. So we're developing those plans. We plan to follow the guidance of the experts on this in the coming days and weeks, and we'll be able to provide more information. But we have vaccines. Anybody that needs a vaccine can get a vaccine through multiple different venues in our community. Please do so. And we are providing boosters in accordance with the recommendations to the immunocompromised already.
Thank you very much.
Hi, everyone. This is Juliana at the Chronicle. I'm curious if any of you have seen more vaccine demand since we got the FDA approval for the Pfizer vaccine.
I'd be happy to take that, and feel free to chime in, Lewis, as well. We have seen an increase in the last few weeks in comparison to weeks previous, where individuals are seeking that first dose of vaccination, which to us is a good indication that there is an increased demand and an interest in vaccination. So we are seeing it across the county, both in our data and then also anecdotally when we're speaking with our COVID-19 vaccine providers, we're hearing that as well. Louis, I don't know if you want to add anything else to that.
Thanks, Lori. I would say that our experience is similar. I don't know if the data is available yet to actually show that there's been an increase, but in conversations that we're having with patients, with employers throughout Gallatin County, requesting more information on vaccinations, we're definitely seeing some encouraging upticks. I think that we need as many people as we can to get vaccinated, not only to protect themselves, but also to allow the healthcare system to function in a manner that allows us to take care of as many patients as possible. Obviously, patients that are in the critical care space take a lot more time, resources, and people. If we just had to take care of the vaccinated patients with the occasional breakthrough case, we'd be sitting a lot better.
Awesome, thank you. And Lori, I'm just kind of curious. So I know through that House Bill, I think 702, you can't necessarily order quarantines for people, is that right? So I'm curious how you're communicating to people who are close contacts that they need to be quarantining.
Sure, happy to answer that. I think the most important thing that I want to continue to stress is that isolation and quarantine remain critical public health control measures to limit the spread of disease transmission. So nothing has changed in terms of the public health response to COVID-19. So when we're doing a disease investigation, we're identifying, we've been notified of a positive individual. We identify close contacts. And then through our conversations that our contact tracers are having, they're providing the guidance from CDC related to their particular situation as a close contact. And then we're proceeding with that conversation with a letter to them describing exactly what they need to do. So if an individual is unvaccinated, we provide specific guidance as it relates to their quarantine timeline, as well as if someone is vaccinated, we provide that same, it's different information based on the CDC guidance for those people who have been exposed and are vaccinated. So we continue to follow the guidance of infectious disease experts who know and understand the importance of isolation and quarantine. And so we continue to follow those same measures. Does that help answer your question?
I think so, thank you. I'm curious if you've run into people who have not wanted to quarantine at all, just based off of that new law.
Yeah, I think regardless, it's tough when you're having a conversation with an individual where they're receiving information that they've had an exposure. Those conversations can be challenging regardless of the situation, because the disease and the notification of an exposure can be scary and frightening for people. So certainly, those conversations can go a lot of different directions. We have extremely skilled staff who have walked people through supporting them through quarantine, to providing them resources to keep them safe while they're in quarantine, whether that be making sure they have the prescriptions they need, making sure they have food and a safe place to be. Those are all sort of the supportive measures that we can provide an individual who needs to quarantine.
Thank you.
Other questions?
Yeah, this is Noah Schmick with ABC Fox Montana. I wanted to ask maybe the Bozeman Health Big Sky Medical Center people along the lines of the hospital strain. I looked at the last weekly surveillance report for COVID-19, and it said that critical and non-critical bed usage was over 70%. And I was wondering if you guys are considering that overcrowded and if those numbers have risen.
Yeah, I can answer that. So when you look at our total bed count, there are different ways of looking at bed availability. We have 19 beds that are antepartum and postpartum beds. Sometimes in a really tight crunch, we'll put female patients on that unit when the competencies of the staff are appropriate to care for them. 10 of those beds are newborn intensive care unit beds. So you can imagine only newborns go in those. They don't even fit the big people. So we have, as Dr. Sullivan mentioned, 20 critical care unit beds. And then we have designated 59 med-surg beds, but have opened an additional 8 to as much as 12 where we previously had our labor and delivery unit. So it's flexible how many med-surg beds we have, sometimes based on staffing, and that staffing can be limited if we have staff that's out because they've had an exposure or they have symptoms. And so even though the number might be 70% on a piece of paper, some of those beds are for our moms that have just delivered or we're watching because they're at risk during delivery. Some of them are for babies, and there are a limited number for our medical, surgical, and critical care unit. And we've actually had over the past, I would say it's really about 6 to 8 weeks, many days in the middle of the day and at night, both through the week, where we've been 100% full and just trying to figure out where we can put someone or if we can call additional staff in to open one of our otherwise unstaffed beds.
Perfect. Thank you. That's great information. And then this one might go towards Lori or Lauren. Did you have to say something? Sorry.
Yeah, thanks, Noah. I just wanted to clarify that the beds that Dr. Bertany is referring to is the beds that are at Bozeman Health Deaconess Hospital. We do have 4 inpatient beds at Big Sky Medical Center with 4 additional beds that we can use if we need. And while we have seen COVID positive at Big Sky Medical Center's inpatient unit, to my knowledge, we have not had to yet extend into those 4 additional beds. Dr. Bertany, can you confirm that?
We have not been transferring patients to Big Sky for care. We do not have respiratory therapy there, so a lot of patients would not be appropriate for us to transfer. And I will tell you that our volumes at Big Sky Medical Center caring for that community and the visitors to that community has been significantly up. Probably our hospital days, I haven't looked to include this month, are up by 100% from last year. And we have an average daily census there of generally less than 1. We don't have a lot of inpatients there. And we've had some days in the past couple of weeks where we've had as many as 3 patients hospitalized. The majority of those have been COVID positive that we've been supporting with medical care.
And Noah, I might just ask, bed management is a highly dynamic art to it. And whether it's looking at internally within our facility and how we can get creative while still providing care in a very safe and effective manner, or looking outside to some adjacent communities and other hospital partners. Operations are not normal, and they're not normal throughout our entire country. And what we're starting to see is this ripple effect of beds as far away as Seattle are filling up. Rural communities in eastern Idaho aren't able to use the traditional transfer channels that they have into these larger systems, so they're looking elsewhere. As this continues, if we do not get a grip on this as a community, as a region, as a local community, the ability to move patients to higher levels of care will become more and more difficult. And so again, would like to advocate that people protect themselves, protect their family, protect their community by seriously considering vaccines, because it's not just what we have in Bozeman, it's what this region and what this country can really provide. And beds are becoming a commodity, if you will. And we will continue to address, we'll continue to bring on staff and get creative if need be. But the easiest way is to get more of our community vaccinated.
Thanks, Lois. I do want to add one thing on to what Lois was saying, and that is the staffing crisis. We definitely have a crisis of staffing for healthcare providers throughout the country. At Bozeman Health Deaconess, we have, Lois, how many now emergency staff that we've brought in to support opening additional beds and making sure we can care for as many as possible? Is it 35?
Yeah, I was gonna say, I think we're at 35 to 40, and that we expect almost 20 additional resources arriving in the next 7 to 10 days.
So we've been partnering with some temporary staffing agencies to bring in emergency staff, and it's not unique. Earlier today, I was on a call with Seattle Children's Hospital with regard to our NICU program development, and they were talking about their staffing crisis and that they were having to transfer patients sometimes out of state because they didn't have the staff. So it's not just at Bozeman Health, but it is here. And so if we can try and right size the demand for our critical care, which of course requires a high level of competency and training and experience, and we always give the patient the right level of care that they need. If we can reduce the demand for critical care, we can care for more patients as they need it for things that aren't related to COVID, because we're still seeing strokes and heart attacks and GI issues and everything else that comes on a regular basis. Thanks.
Yeah, no, thank you guys for all that information. It's very helpful. And then my last question, I probably goes to Lori, but when people do test positive for COVID-19, are they told what variant they have? And if not, I mean, I just know that a high number of them have been that Delta variant. I'm just wondering why we maybe don't give out that information.
Sure. So I think the important thing to remember is that there is definitely a lag, and when someone tests positive, that test needs to be sequenced specifically, and not all single tests are sequenced. And I'll let Dr. Sullivan add to this too, but in terms of whether or not someone was infected with the Delta variant, in terms of a public health measure, the same measures would apply in terms of the requirements to isolate and the importance of identifying those that you may have been in close contact with. So while I think there's an interest in understanding whether or not someone has the Delta variant, and from a public health perspective, it's important that we're continue to focus on those public health measures that I just mentioned, the isolation and quarantine. Dr. Sullivan, do you want to add anything to that?
Yeah, we treat all the variants the same. I have no idea which one of my patients has Delta variant or not. They get the exact same treatments. And so it's not clinically, it's not useful to know.
Thanks,
Perfect.
Noah.
Yep.
Thanks. Any other questions?
I have another question, Lori.
Yeah, Annie, go ahead.
I think this is for Lewis, but my question is, I know that it's been very vocal from medical professionals about wearing masks throughout this pandemic, but why the need for a unified front between the healthcare systems for supporting masks in school? Has the opposition been too loud? Is there too much misinformation? I guess why the need for this support?
Yeah, I think that one of the things that we saw with the back to school is that the transmission just changed. There was kind of an uptick, and whether there was an uptick in actual documented cases of viruses, I don't have that data right now, but we know that as people go back to school, there will be cases. There'll be, even if people aren't being admitted to the hospital, people are going to want to get tested as soon as the youngster in one classroom tests positive. And what all we hope is that those masks can save just one life. And we know and we believe in the science. And while there are people on all ends of this conversation, we move beyond the politics. we're about the science, we're about taking care of our communities, and we're about utilizing the information that we have to the best to our ability. And we really thank the community leaders and the elected leaders that have chosen to enact this very minor mandate to help protect our kids. And we believe that not only will that protect the kids, but that will prevent having undue stress on our health system, so that we can protect and we can save as many lives as possible.
And I'd just add to that, remember, kids less than 12 can't be vaccinated. And so they're at higher risk of severe disease.
Perfect. Thanks, guys.
All right, lots of great questions today. Are there any others?
I had a few quick questions for Tracy. Hello. I'm curious, do you know the percent or how many students at MSU were vaccinated? I'm not sure if you guys measure that specifically for the university or not.
Yeah, Juliana, thanks. That's a great question. And it's pretty much very, very difficult. We don't have those numbers because there's not, to my knowledge, there is no national data clearinghouse on who's been vaccinated and who hasn't. So, we know students that we vaccinated last year, but we have no idea of who was vaccinated over the summer in their home states or in their home communities. Also, we can't require a student to disclose their vaccine status. What I can tell you is that we have an incentive program, right? That is a sweepstakes that offers prizes for students who register and provide evidence that they have received the vaccine. So we're only the third day into classes, and we have 3,400 entries into that sweepstakes. And that sweepstakes goes all semester long, and it involves a marketing program that goes every week. So we are encouraged that we had 3,400 entries actually as of yesterday, which was only the second day of classes. So that's the only data point I can provide you.
Awesome, thank you. And then I had some questions about that mask mandate yesterday, which I know we talked a little bit about last night, but I guess one question I had, kind of thinking about that mandate and only in instructional spaces, what that means for some of the office areas, like financial aid office or something like that, where they're still having that kind of direct face-to-face contact with students, if MSU might consider expanding the mandate, or kind of how that's covered for those areas.
Juliana, the mask requirement applies only to indoor instructional spaces, because those are spaces where you have a high density of people gathered for, an hour, sometimes longer. And everything else is more of a transactional kind of relationship that doesn't have that density or necessarily that amount of time. So that's why we have focused on and continue to focus on just the instructional spaces.
What would you say to staff members, who aren't professors, who aren't teaching classes, who might feel like they're not getting that same level of protection as the professors in the classes?
Well, I would say that they can certainly ask a student who comes in for services if they would consider wearing a mask while they receive those services.
Awesome, thank you. And I'm just going to ask this question again. What would it take? Is there a certain metric or something like that for MSU to ask for masks in all indoor spaces or more indoor spaces on campus? I'm just curious if, if we get to certain case levels or hospitalizations or something like that.
Juliana, the message we put out last night to all students, faculty, and staff for a mask requirement said that we would evaluate that on October 1st, which is not that far away. So we'll be looking at what's going on in terms of the community on a whole variety of metrics, but we don't have a formula in the desk right now that we can share.
Thank you for answering my questions. I have one more, just kind of about that staff versus faculty, since staff aren't really in classrooms and don't get that same mask mandate. Do you think that inadvertently sends a message that staff aren't as important as faculty, or aren't having that same level of protection as faculty, who are in classrooms?
Well, that seems a surprising way to view it, because requiring masks in the classrooms has a net effect of protecting everyone on campus.
Well, thank you so much for answering my questions, Tracy.
Okay, are there other questions? Okay. Well, I just also want to share my appreciation for our healthcare workers, of the administrators who are in the boards of trustees, and individuals who are making really hard choices, making hard decisions, and caring for our community. So I just wanted to make sure I mention how much we appreciate the work you're doing. It's hard work. And I encourage everyone to stay safe, continue to be kind to one another, and we'll see you all next week.
Thank you.
Thank you.